All right, guys, so in drawing the muscles of the upper leg, we're just going to start with the pelvis like we normally would with life drawing. So if I'm drawing from the front, I'm going to start with those 2 points of the pelvis, the superior anterior iliac spine. I would come down. Here would be the pubic symphysis. Remember, this would kind of be the oblique. This is our anatomic midpoint, and if I'm drawing a male, that would be the wide point. So I'm just kind of drawing like where the hip would be, and then whenever I'm trying to figure out how long to make the leg and I only have this to go off of, not the whole, because you know we do head to the pubic symphysis to the floor, halfway up to the knee, and then that would give you the upper leg. But now I'm just going to decide, okay, do I think that the width of the hips equals the length of the leg? So look at your model and you can kind of determine it. You just have to have something down to compare the next thing to. So when we're doing life drawing, we're always just kind of starting off with, like, here's the form, and this mark represents where the kneecap would be, and we know that we're going to be round on the inside, flat on the outside, and then we'll look at the parts of the knee. So this is easy. This is what we always do in life drawing, and we always also look for this line right here. We're usually looking for that line that shows us the adductors, but now we know what that line actually is, and that line is the Sartorius. And if this is the point of the pelvis, it's not just actually a little point, but it's the whole crest of the pelvis coming around like this. The Sartorius is about 2 fingers wide, and it's a strap, and it's just going to follow down and around, and it disappears for a minute, and then it reappears as part of the goosefoot tendons. So I'll do this, and then this will be the patellar ligament and the continuation of the leg. So that would be the Sartorius. We have our tensor fascia latae, which grabs on from that point of the pelvis to the femur, so the trochanter of the femur. So we have these 2 things. This would be the gluteus medius over here, and this kind of sets everything up for us. So we can start with these. If I wanted to put like the tendons in and the striations, I could go ahead and do that. And what that leaves us with is this hollow V shape here, and this is where our quadriceps start. And it leaves us this here, which is where our adductors start. So when we're looking at where that line of the pelvis kind of wraps around and becomes the pubic symphysis here, this is where those adductors start. Remember, we have the psoas muscles, our hip flexor muscles that are coming from above. We actually kind of talked about that when we did the back. That muscle would kind of show here, and it would be covered by the inguinal ligament. And then under that, we would have the pectineus. So that's doing this. So the psoas is kind of going this way. And then the pectineus is coming across. All of these muscles are grabbing onto the femur. So if my femur is in here, and it becomes a big condyle here, all of these muscles are grabbing onto the back of it. So we'd have our pectineus, we'd have our adductor longus, the brevis would kind of be right in here underneath. Anytime something's called longus, there has to be a brevis. And again, they're going through, they're just getting covered by what's here. The brevis, we would see the gracilis, which is another real long strap-like muscle that's just kind of going straight down and around and joining the goosefoot tendons. And then anything else in here would be the Adductor Magnus, which is really deep. I'll still show it. And remember, the Magnus goes all the way down the whole leg. And so I'm just going to show that these 2 are on the top, the pectineus and the Adductor Magnus, and then or longus, and then the adductor brevis and magnus are kind of underneath there. So we'll kind of do that, and then I'll really kind of push the Sartorius forward and get these guys just a little bit deeper. So let's keep this going. Now we have room for our quadriceps. So we know that the vastus medialis is the low one. It actually grabs on to the kneecap like this. We know that the lateralis is higher, but the IT band crosses it. So the IT band is sitting on the edge like this. And then we know that the rectus femoris, this guy, is the highest one of all. and it's a feather muscle, a bipinnate, and it's grabbing on not to the superior point of the pelvis, but the inferior point right here. So that's why we have this kind of a V shape, and then underneath that, here's our rectus. So I'll start rectus femoris because I want to show those feathers. I can either show like a white tendon in the middle, or I can just kind of show the variation in the striations going this way and this way to show that feather on either side. And maybe I want to show like it's darker up in here because it's coming out from in between. I'll show that for now. And then these muscles, remember, they're all sharing this common tendon which grabs onto the patella, and then the patella sends its ligament down to the tibia. Remember, the only difference between a ligament and a tendon is tendon connects muscle to bone, ligament connects bone to bone. So these striations, so this guy's up high, these striations are going this way, and this is wrapping around too and joining that linea aspera on the back of the femur, which is really surprising that we're getting that wrap around. So we've got this coming this way, this is going this way, and ending. I want to fill this in just a little bit more. There we go. And remember that the IT band sends a little helper band, the Richet band, like so, and joins the goosefoot tendons. And so I'm going to do this because it's sitting on top of everything else. So we have something like this. So these goosefoot tendons are created by, we're going to have our Sartorius, we're going to have our Richet's band, we're going to have the roundness of the inner knee also by this vastus medialis. We've got our gracilis and even our hamstrings. They all come around like so, and then this IT band joins on the tibia itself. So here's kind of what we're seeing on this front view. And again, where do I want to go deep? Well, maybe where something's kind of crossing something else or sticking out from under something else. You guys get to decide. Again, if you want to emphasize the striations, you can. If you want to use your red Conte or your digital, you're welcome to do that. If I'm doing the back of the pelvis, I would have, if this was my glute muscle, and here's the outer part of the pelvis, I would have my thigh coming down. And remember, the back of the knee, we look for that H shape, and we're still round on the inside and flat on the outside. Again, the goosefoot tendons here and the IT band here. We're going to kind of imagine where the glutes kind of come down and they grab this IT band like so. However, we have a tight fascia that pulls this up towards us that we're used to seeing. We drew this before, but if you still want to draw those striations and stuff for the glutes, you can. Underneath are the hamstrings. So the hamstrings, there's 4 parts to them, but what we're going to see on the outside is mainly the biceps femoris, long head, and then on the inside, what we're mainly going to see is the semitendinosis. So biceps long head, because the long head goes all the way up. Here's our pelvis up in here. We're seeing the ischial tuberosity. These guys are grabbing onto all of that. And then inside we would still have our Adductor Magnus and the gracilis going like this. And so underneath this longus, the biceps longus, there's going to be a brevis, and it actually ends on the femur itself underneath. It's kind of doing this. But the longus goes all the way up underneath the glutes. So you can kind of do that. And then the semitendinosis, remember it's called that because it has a tendon, a little tendon that kind of does like that inside. So if I was doing the striations, I would kind of like maybe show that little tendon. So you can see that there's something bisecting the muscle. I would show a shadow probably. Let the muscles be shadowed. And remember that they spread apart at the bottom, and this is the popliteal fossa, and this is covered with fatty material because you've got your popliteal vein, artery, and your tibial nerve coming straight down here, and they've got to be protected. This set of tendons, these two, go to your fibula, and this wraps around, helps the goosefoot tendons round out and hits your tibia. So they're not on the back of your leg at all. They round out like a pair of tongs almost to grab onto the outside. Remember, underneath this semitendinosis is semimembranosus, and it also doesn't quite make it up to the top, but it's a big, it has an aponeurosis instead of just a tendon at the top, and that's why it's called membranosis, because it's a membrane type tendon. So that's kind of what we're seeing here. And then here's the IT band coming down and joining this as well. So I think from the back we're pretty easy. I would maybe suggest, you know, kind of showing, maybe we see some of that ischial tuberosity, and we can kind of see where everything's grabbing onto, so that it's a little bit more clear for us. That would be nice to see in your drawing as well. So from the back it's pretty easy because we're just seeing the hamstrings, and then it's all just, you know, creating your layers, seeing what's underneath. Maybe I want to show this, you know, really dark in here, but then I want to show these veins and arteries sticking out. That's totally up to you. From the front, we're starting with the triangle shape. From the back, you know, you can start with your circle, with your sacrum. Here's the glute, and then get your leg happening from there. It's totally up to you on, you know, how close up you want to see, but fill up the page. Notice I didn't do the whole figure. I'm filling up the page with either the front or the back of the leg. If you're doing the side, you're mostly going to see IT band. I'll just do it real quick. So if this was the side of the pelvis, you have your flat space, and then here's the meat of the leg. Here would be the knee. Here would be the back of the hamstrings. What I'm seeing, here's where the body comes in. What we'd be seeing here is, here's the trochanter, tensor fascia here, gluteus medius, gluteus maximus. This is all IT band, all coming all the way down and grabbing onto the tibia. We would see hamstrings here with their band coming down. This would be vastus lateralis here, and I might even go a little bigger, and this would be rectus femoris coming straight down here. So what you want to do in this case is emphasize the band, and maybe I'll even show that little Riche's piece kind of wrapping around that. So on the side, it's like we have a lot of the pelvis muscles, and then everything else kind of sticks out from there. But I would want to show like the hamstring fibers are going straight up and down, whereas the vastus lateralis are going in a diagonal, and then we probably wouldn't see much of both sides of the, remember the tibialis is a feather, so I'm kind of showing one side of that feather, and that's kind of what we're going to be seeing for this. So that's the side views. So remember, from the front, we're just starting with our points of the pelvis. We're making a triangle. Here's the oblique. We're widest at the pubic symphysis, and then we can drop down. You can kind of figure out like how wide the hips would be compared to how long until we get to the knee. From the side, we're starting with the C shape, flat space, and then the meat of the leg. We're going to put the body in there and then drop down to the knee. And in the back, we can start with the circle, look for the gluteal fold, the sacrum, here's the crest of the pelvis, and then about halfway down the gluteal fold in the back. If it's a male, that's the widest part of the pelvis. If it's a female, go lower and wider. And then you can determine if you think this and this are the same. Just compare it to something that you have. And then we're looking for the H shape on the back of the leg. So just a simple way to get started. And when we look at the examples, we can see different ways of setting it up. Some people decided to do both legs. Some people wanted to really focus on just one area of the leg. So it varies. Think of your composition as a whole. And again, do what you're comfortable with. If you want part of it to be flesh and part of it to be muscle, that's great. There's not a ton of layers to do, so we're just kind of superficial here. So next week, we're going to do the lower leg and foot. Let me know if you're having any questions with this at all. I can help you, and happy drawing.